Welcome to today's video lecture. Today, we're going to delve into a fascinating topic, gastritis. Before we start, don't forget to check out our website modefamedical.com for hundreds of more videos like this at the end of this video. The link is in the description. In this session, we will delve into the intricacies of gastroenteritis, including its etiology, pathophysiology, clinical presentation, diagnostic approaches, and management strategies. By the end of this lecture, you will have a comprehensive understanding of gastritis and its impact on patient care. So, let's begin.
Gastroenteritis is an inflammation of the gastrointestinal tract, specifically the stomach and intestines. It is a condition characterized by symptoms such as diarrhea, vomiting, abdominal pain, and nausea. Gastroenteritis is typically caused by an infection, which can be viral, bacterial, or parasitic in nature. When discussing gastroenteritis, we must consider both the acute and chronic forms of the condition. Acute gastroenteritis refers to a sudden onset of symptoms that usually resolve within a short period, typically lasting a few days to a week. On the other hand, chronic gastroenteritis refers to persistent or recurrent inflammation of the gastrointestinal tract, lasting for several weeks or even months. The pathophysiology of gastroenteritis involves the understanding of the underlying processes and mechanisms that contribute to this condition. Infection and inflammatory response. Gastroenteritis typically begins with the ingestion of infectious agents, including viruses, bacteria, or parasites. These agents can enter the body through contaminated food, water, or contact with infected individuals. Once inside the gastrointestinal tract, they attach to the lining of the stomach and intestines, leading to infection. Epithelial cell damage. The infectious agents cause damage to the protective barrier of the gastrointestinal tract, primarily the epithelial cells that line the inner surface. They can disrupt the integrity of the epithelial layer, compromising its normal functions, including absorption and secretion. The damage triggers an inflammatory response in the affected area. Increased fluid secretion. In response to the infection and inflammation, the gastrointestinal tract activates various mechanisms to combat the invading pathogens. One of these responses is the increased secretion of fluid into the intestinal lumen. The secretion of fluid helps to flush out the infectious agents and toxins from the body, but also leads to diarrhea, a hallmark symptom of gastroenteritis. Altered absorption. As a consequence of the inflammatory process, the absorption of nutrients and water by the intestines may be impaired. The damaged epithelial cells may have reduced functionality, resulting in decreased absorption of essential substances, including electrolytes and water. This further contributes to fluid loss and dehydration. Disrupted intestinal motility. Gastroenteritis can disrupt the normal rhythmic contractions of the intestines, known as peristalsis. This disruption can lead to changes in bowel movements, such as increased frequency and urgency. The altered motility patterns may contribute to diarrhea and abdominal cramping. Activation of the immune response. The body's immune system plays a crucial role in combating the infection and resolving the inflammation associated with gastroenteritis. Immune cells, such as lymphocytes and macrophages, are mobilized to the site of infection where they release inflammatory mediators to neutralize the pathogens. However, excessive or prolonged immune activation can lead to tissue damage and exacerbate the symptoms.
Let's discuss the clinical presentation of gastroenteritis, as observed during patient assessments. Diarrhea. Gastroenteritis is characterized by the presence of loose or watery stools. The frequency of bowel movements may increase, and the stool consistency can range from mild diarrhea to severe liquid stools. Vomiting. Patients with gastroenteritis often experience episodes of vomiting, which may be preceded by nausea or occur spontaneously. Abdominal pain. Abdominal cramping or discomfort is a common symptom of gastroenteritis. The pain is typically located in the lower abdomen and can vary in intensity. Nausea. Many patients report a feeling of queasiness or the urge to vomit, often accompanied by a loss of appetite. Dehydration. Thirst and dry mouth. Fluid loss through diarrhea and vomiting can lead to dehydration. Patients may feel thirsty and experience a dry sensation in the mouth. Decreased urine output. Dehydration can result in reduced urine production and darker colored urine. Fatigue and weakness. Fluid and electrolyte imbalances, coupled with dehydration, can cause fatigue, weakness, and a general sense of malaise. Fever. Some patients with gastroenteritis may develop a low-grade fever, typically below 101 degrees Fahrenheit 38.3 degrees Celsius. However, fever is not always present, especially in cases caused by viral agents. General symptoms. Headache. Patients may experience headaches, which can be attributed to dehydration or the systemic effects of the infection. Muscle aches. Body aches and muscle discomfort may occur as a result of the immune response and general malaise associated with gastroenteritis. The diagnosis of gastroenteritis involves a combination of patient history, physical examination, and diagnostic tests. Let's discuss the typical diagnostic process for gastroenteritis. Medical history. The doctor will inquire about the patient's symptoms, including the duration, frequency, and severity of diarrhea, vomiting, abdominal pain, and other associated symptoms. They may also ask about recent travel, exposure to contaminated food or water, and any contact with individuals who have similar symptoms. The doctor will perform a physical examination to assess vital signs, hydration status, abdominal tenderness, and any other relevant findings. They will check for signs of dehydration, such as dry mouth, decreased skin elasticity, and low blood pressure. Stool sample analysis. Collecting a stool sample for laboratory analysis is an essential diagnostic step in gastroenteritis. The sample can provide valuable information about the causative agent. The tests commonly performed include: microscopic examination of stool is very important. Stool samples are analyzed under a microscope to detect the presence of parasites, such as Giardia lamblia or Cryptosporidium. Bacterial cultures help identify specific bacterial pathogens, such as Salmonella, Campylobacter, or Shigella. Sensitivity testing can determine the susceptibility of the bacteria to different antibiotics. Therefore, culture and sensitivity play a significant role in the diagnosis of gastroenteritis. PCR can detect and identify viral pathogens, including norovirus and rotavirus, with high sensitivity and specificity. In some cases, blood tests may be ordered to assess the patient's overall health status and evaluate for complications, such as electrolyte imbalances or signs of dehydration. These tests may include complete blood count to assess white blood cell count and hemoglobin levels. It is important to measure the levels of serum electrolytes, including sodium, potassium, and chloride, which can be altered due to fluid losses. Renal function tests such as blood urea nitrogen and creatinine levels, to evaluate renal function. The treatment of gastroenteritis focuses on managing symptoms, preventing complications, and supporting the patient's recovery. Here are the key aspects of treatment for gastroenteritis. Fluid replacement is very important while treating gastroenteritis. In mild to moderate cases, encourage the patient to drink oral rehydration solutions such as ORS, or clear fluids containing electrolytes. These solutions help replace lost fluids and electrolytes and aid in preventing dehydration. If tolerated, small and frequent sips should be encouraged. Intravenous fluids. In severe cases of gastroenteritis with significant dehydration or inability to tolerate oral intake, intravenous fluids may be necessary. This route ensures rapid and effective rehydration, especially in cases of persistent vomiting or diarrhea, severe dehydration, or compromised oral intake. Symptomatic relief should always be offered to the patient with gastroenteritis. Antiemetic medications may be prescribed to control severe nausea and vomiting, especially if they hinder oral rehydration efforts or significantly affect the patient's quality of life. Commonly used antiemetics include ondansetron and promethazine. In some cases, antidiarrheal medications, such as loperamide, may be used to alleviate excessive diarrhea. However, these should be used cautiously and only in selected cases, as they may prolong the infection or mask underlying complications. Supportive care should be offered to patients with gastroenteritis. Encourage the patient to rest and allow the body time to recover. Once symptoms improve, reintroduce a regular diet gradually. A balanced diet with easily digestible foods is recommended. Breastfeeding or formula feeding should be continued for infants and young children. Over-the-counter pain relievers like acetaminophen or nonsteroidal anti-inflammatory drugs, NSAIDs, may be used to manage abdominal pain or discomfort. However, caution should be exercised when administering NSAIDs, as they can irritate the stomach lining.
In conclusion, understanding the clinical presentation, diagnostic evaluation, and treatment options for gastroenteritis is very essential. By diagnosing and managing gastroenteritis effectively, we can improve the quality of life for our patients. And that brings us to the end of our today's video. I hope you found the information helpful and informative. If you enjoyed this video, don't forget to give it a thumbs up, and don't forget to sign up for a premium membership on our website, madeformedical.com, for more content like this.